Hi, I'm Dr. Davide Bimbatti. I work at the Istituto Oncologico Veneto in Padova, Italy. I'm going to present our poster, Clinical Parameters for First-Line Immunocombination Choice in Metastatic Renal Cell Carcinoma, the MEET-URO 33 study. Why we have performed this poster? Because there is an unmet need in the way we choose the first-line treatment in metastatic renal cell carcinoma. Many combinations are available in these years, but there's no head-to-head trial, so the choice is a challenge. We performed this trial is an observation trial with a retrospective and a prospective part. So this is the first results, mainly for the retrospective analysis. We enrolled more than 500 patients along more than 20 centers in Italy, and we tried to understand why the physician choose one combination instead of another one with the patient in front of him. We mostly see that physicians prefer combination with TKI and immunotherapy if the patient is in the poor prognosis classes by IMDC or MEET-URO score. And on the other hand, there is a slight preference for ipilimumab and nivolumab if the patient has an intermediate IMDC score and not so high burden of disease. On the other hand, we saw a certain preference for nivolumab and Cabozantinib, especially for the presence of Cabozantinib for patients with papillary renal cell carcinoma and for patients with bone metastases. This is only the first analysis, so the main limitation of the study is the retrospective conduction, so many biases are in there. And on the other hand, the median follow-up probably is not so long, but the importance of this asset is not only for this result, but to highlight the efforts of the MEET-URO to create a huge and large data set in Italy involving many centers. We are projecting to open at 80 centers this trial. And on the other hand, with more time, we are going to collect many data from other patients and prospectively collecting all the data of all the consecutive patients in order to have a real-world data prospectively maintained to try to answer to many questions that clinical trials are not answering. Thank you.